Hi, my name's Dr. Adam Fox and I'm one of the paediatric allergists at St Thomas's Hospital, and I'm here to talk about managing hay fever. Hay fever is an allergy to pollen. It can be to either tree pollen, which tends to start in around February time and run through to April, May, or to grass pollen, which tends to be worse in April, May and June. It's really common. It affects around 25% of adults in the UK and somewhere between 10 and 15% of children. There's a number of ways to try and manage it, because although most people consider hay fever to be just a little bit of an irritation, for some people it's a very significant problem and has a very real impact on day-to-day quality of life. There's three basic ways of trying to manage hay fever. The first is to avoid the allergen, the second is medication, and the third is immunotherapy or desensitization. Avoiding the allergen in pollen allergy is very, very challenging and very difficult to do. It's certainly useful to keep an eye out for pollen counts on the news, or there's apps or websites that can tell you what they are so that you can plan your activities on high pollen days. But ideally, if you're severe enough that you're having to do this, then you need to be thinking about other methods as well. Wraparound sunglasses can be helpful, pollen filters in the car can be helpful. It can be useful to avoid going out early in the day at dawn or at dusk, because that's when the pollen levels are highest. And some people find it useful, for example, to avoid washing their laundry and drying it outside, instead doing it inside, or washing their hair every night so that they avoid transferring pollen from their hair onto their pillow and then rubbing their nose in it during the night. For most people with significant symptoms, however, they're going to need medication. The first line of medication are antihistamines, and it's extremely important that these are the long-acting, non-sedating type, because these work much better than the older, sedating, short-acting antihistamines. In practice, this means when you go to the pharmacy, because these are over-the-counter medications, you should be asking for cetirizine, loratadine or fexofenadine, and not Piriton or chlorphenamine. If antihistamines aren't helping, then it will be very useful to go up to the next step of medication, which is a nasal spray. Nasal sprays are very effective and they're also very safe. Many of them can be bought over the counter, but some of them require a prescription. Nasal sprays are particularly good if your nose is very, very congested, whereas antihistamines are often more helpful for the sneezing and itchiness that you get. They work very well together. So for most people with significant hay fever, a combination of a long-acting, non-sleepy antihistamine together with a nasal spray will be enough to keep things under much better control. Occasionally you may have symptoms despite having those medications regularly, and it's perfectly safe to increase the dose. Some people, despite being on all of that medication, still have very significant hay fever problems that interfere with work, sleep, or school attendance. For those children, there are other options, and that includes desensitization. Desensitization is also known as immunotherapy, and it's a treatment where we use the allergen that you're allergic to, so it would either be the tree pollen or the grass pollen that's causing the problem, and deliberately give it to the child, which eventually desensitizes their immune system, essentially making you less allergic. It doesn't completely get rid of the allergy, but if it works very well, it can significantly reduce your symptoms by 30 to 40%. However, the treatment is quite involved and involves having regular doses, either injections or more commonly in children in our allergy service, having squirts, drops or tablets of the allergen under the tongue on a daily basis for months at a time and for a number of years. One of the benefits of desensitization is that if you complete a 3-year course of treatment, the benefits that you get from that should last for many years afterwards. Desensitization isn't right for everybody, and this is something you should discuss with your allergist when you come to clinic if your symptoms are bad enough despite taking regular medication. The medication, the medication, the medication, the medication, the medication.